Cyanosis, it is the bluish coloration of skin and or mucous membrane due to the presence of at least 5 gram of reduced hemoglobin per 100 ml of blood in the capillaries. So here the cyanosis is bluish discoloration of skin or mucous membrane. So due to the presence of at least 5 gram of reduced hemoglobin. So here the hemoglobin is less than 5 gram of hemoglobin per 100 ml of blood. So site. Cyanosis is seen at the sites where the skin is thin. Example, mucous membrane under the surface of the tongue, lips, tip of the nose, ear lobules, nail buds. These are the example for the cyanosis occurring sites. So this picture showing the cyanosis occurring on the fingers, terminal end of the fingers. So causes for the cyanosis. First one is hypoxic hypoxia, stagnant hypoxia. Hypoxia is the reduced oxygen level. So in polycythemia, there is an increase in total hemoglobin content. So polycythemia aggravates the cyanosis. And local factors, exposure to mild cold, that is approximately 20 degrees Celsius, cyanosis by cutaneous vasoconstriction, and exposure to severe cold, approximately 10 degrees Celsius, there is no cyanosis because of the oxygen consumption of tissues decreases markedly. So mild cold there is produce cyanosis, but in severe cold there is no cyanosis. It is very important. And anemic hypoxia, and that cannot cause cyanosis, and carbon monoxide poisoning cannot producing these cyanosis, and histotoxic hypoxia and cannot cause cyanosis. These are the other causes for the cyanosis: airway problems, choking, swelling around the vocal cords, inflammation of the flap in your throat that covers your windpipe, lung problem, high altitude, asthma, infection in the respiratory tract, blood clot in an artery of the lung, chronic obstructive pulmonary disease, that is COPD, pulmonary hypertension, pneumonia. There is lot of causes for the cyanosis. These are the conditions that causing the cyanosis. Mainly respiratory conditions most commonly produces the cyanosis, and cardiac problems also producing cyanosis. So choking also called suffocation. Blood clot in an artery of the lung. Other causes are heart problem, that is the heart defect that were present at birth, that is congenital heart disease. What are the congenital heart disease? Double outlet, right ventricle, and tetralogy of the fallet, and congestive heart failure, cardiac arrest. Other causes for cyanosis are wearing clothes that are too tight and limit your circulation. These also cause cyanosis. Wearing too tight dress, exposure to extreme cold, and Raynaud's phenomenon, a disorder that causes your blood vessels to narrow. It also producing cyanosis. And medication that are used to treat high blood pressure and seizure, drug overdose, toxic exposure. So drug overdose also produce cyanosis. Medications that are used to treat high blood pressure, so hypertension medications also produce cyanosis. When it is toxic, that is overdose, it causes cyanosis. And symptoms: low body temperature, that is hypothermia, numbness or tingling in the arms and legs, coughing, wheezing, difficulty breathing, dizziness, extreme tiredness or fatigue, and weakness. These are all the symptoms for the condition of cyanosis. So low body temperature is very important, and numbness or tingling in the arms and legs, coughing, wheezing, difficulty breathing, dizziness, extreme tiredness, and weakness. Next, moving on to test. How will you diagnose the cyanosis? First, these tests can include various blood, lung, and heart tests. So we have to diagnose the cause for the cyanosis. First one is pulse oximetry. So it measures the amount of the oxygen in blood by attaching a sensor to your finger. And next one is arterial blood gas analysis. It measures the amount of oxygen and other substances in the arteries. This is the blood that has most oxygen in it. And chest X-ray, chest computed tomography, CT scan, and complete blood count, electrocardiogram. It measures the electrical activity. And echocardiogram. It is an ultrasound of heart that shows its function and structure. And pulmonary function test. It diagnoses the lung condition. And cardiac catheterization. It diagnoses the heart condition. These are all the tests to diagnose the cause for the cyanosis. Mainly, pulse oximetry is most commonly used because it measures the amount of the oxygen in blood. And arterial blood gas analysis. Next, moving on to treatment. The first treatment and the best treatment is oxygen therapy. Ventilator depends upon the severity to condition, and other possible treatments include warmth and massage. Exposure to cold temperature and conditions such as Raynaud's phenomenon may be treated with warming and massaging the affected areas. So, antibiotics can treat infections such as pneumonia, and other medication to treat heart and lung conditions. Discontinuing the medication, stop taking certain medication which are cause the cyanosis. And inhalers, if a lung condition such as asthma or COPD caused the cyanosis, we have to use inhaler to help the lungs work better. So surgery, congenital heart defect such as tetralogy of Fallot may need surgery soon after birth. These are the treatment available for the cyanosis condition. So we have to treat the cause for the cyanosis.